Hey, so Dr. Fisher here. I'm with a great patient, Greg, G2, because his dad's Big Greg. He is an amazing representation of what corrective care can do along with traction. And little background is, I'm gonna brag about him a little bit.
Okay.
Great athlete, great basketball player. Were you nationally ranked at one time?
Yeah.
Yeah. Nationally ranked in basketball. Okay. And you're how old are you now?
19.
19 years old. Great family. His dad is an ophthalmologist, right?
Optometrist.
Optometrist.
Yeah.
I'm sorry, optometrist. sorry, G1. But he practices up in
the Bay, NorCal. Yeah.
NorCal, up in the Bay Area. And his dad, great guy, loves his son, totally invested in his future, academically and athletically. And he's been having some really bad issues with his low back and knee, but low back mainly. And that's one of the reasons why his dad did a lot of research and found me and called me, talked to me ahead of time to find out, realistically, what the possibilities were. And I told him, I said, look, I haven't seen your son yet, but I promise you, I have, 2 young sons myself. I'm going to treat him like he's my own son and do the best we possibly can. And I'll be honest with you, if I can't help him, I'll tell you. And so the great thing is that when Greg came in, he had already had an MRI done of his low back, and you had old x-rays too, I believe.
Yeah.
Right, but I took my own, of course, and looked at the MRIs. But to start, what was your main problem when you first came in? What tell us about your low back.
It was pretty bad, I would say. Like, even when I was driving, sitting in the car for more than 20 minutes, my back would hurt. Could only shoot really every day. Really wasn't a day where it didn't bother me. Couldn't do ab exercises. Couldn't do anything. I felt trapped basically.
Yeah. And you were having weakness in your leg.
Yeah, pretty bad.
Mm-hmm.
Like, even the back exercise, like extensions and all this rehab that people tell you to do, it just didn't work. And I did feel very hopeless. And I didn't know what to do.
Yeah. I remember when you guys came in, you guys were at a bad spot.
Yeah. Everyone was bad. I was bad. My family was bad because we just didn't know what to
do. I know,
do.
exactly. I mean, it was depressing because,
right.
Athletics has always been a huge part of your life.
Yeah.
And I could totally relate to that. Ex-athlete, but I've had, sons that played college football and everything, so I totally know.
Yeah.
And the interesting thing is that when you came in, I always do an orthopedic evaluation and neurological evaluation. And when we tested your reflexes and your sensation and your muscles, everything was off.
Yeah.
And you had a lot of weakness. It was on the left side.
Yeah.
A lot of weakness. Reflexes were slow. Sensation was low with the pinwheel testing, and muscle strength was really diminished. And so, after looking at his x-rays, I was like, okay, pretty significant scoliosis and really, really big disc herniation in his low back. It was like a 7.83 millimeter posterior lateral disc herniation. But the reason why I wanted to do this video was that Greg is an amazing example of a couple of things. One is the potential to correct the spine is totally real. And when he came in, I told him and his dad, I go, honestly, I don't know how much I'm going to correct. I know I'm going to correct some, but I don't know how much I'm going to correct. And we had no idea how great his results would be on his x-ray and his MRI. But the other thing is, he was an amazing patient, super dedicated. His family's super dedicated, to him getting better. But he was super dedicated. He used myFisher traction at home, like all the time.
Yeah, like at least once a day, usually 2 to 3 times a day.
Yeah. Which getting patients to be as committed and dedicated to their care is always a struggle for me and for all of us, chiropractors. But he was a great patient. And I really strongly feel that the fact that he did his traction at home so much it really helped with the momentum of correction, because his results are very, very good. They're almost amazing. And the traction, you liked it so much because why? Why'd you like it so much?
I liked how simple it was. Like when I went home for breaks, back up in the bay, I could bring it in my bag. It would take up about zero space, and I could do it just about anywhere. You know, I could wear a wife beater, hop out of bed, and do it just like that, and I'd feel better instantly like that. And then I could do it on my back or on my stomach. So I ended up finding I could do it on my stomach, which worked for me well.
Yeah.
So I think that flexibility was great, and I'd never seen anything like it before. So it was like eye opening, honestly.
Yeah. And that's the cool thing about it, is it has so much versatility. You can do it laying on your back, supine, or laying on your stomach in extension. So you're doing Cox procedures and McKenzie procedures, and sometimes we don't know what's going to work. And having patients that are willing to try both, is really important for me, because then I can see, oh wow, he's an extreme case. He can do, in both positions, and both positions were beneficial. And sometimes you need both, not just one.
Yeah.
And it really enabled me with my corrective care adjustments, where we got a lot of motion right in the beginning.
Yeah.
And you started to come in, was it December, October?
I think it was October.
October of last year, 2024.
Yeah.
Okay. And we took your second set of x-rays after, 6 months of treatment, and you came in, at least twice a week.
Yeah, like twice a week.
And that's typical for a corrective care plan with the curve that he had. I always do my estimates and calculations about how much treatment all my patients would need. And your whole plan was was it 50 some odd visits? I can't remember.
Something like that, yeah.
Yeah, for correction.
Yeah.
But here's the cool thing. You can see with your own eyes, this is before, okay? Look how much curve he had.
Yeah,
A lot of curve. And then after is here, he's almost straight. And I never tell patients unless I know with certainty that, hey, look, I'm gonna get you back being straight. With you, I was like, I don't know if we can get a 50% reduction, that's gonna be successful. But now, because he's not even done with his corrective care, now I truly believe I can get him back to being perfectly straight, which is amazing results. Okay, now check this out. So that's his curve, which most, a lot of people, and you even had people in your own family tell you, you can't correct scoliosis.
Yeah, and they're MDs.
Yeah. Exactly. But don't let anybody tell you that scoliosis can't get better, and it can't. Some cases, I'm gonna be honest, they can't be corrected, but there are a lot that can, and especially the younger you are, the chances of it correcting are greater and greater. But don't allow yourself or anyone else to tell you, oh, you'll never get better. You can't get better, it's impossible. You can, it's the truth. And I'm extremely honest about it, and I try and give realistic expectations to my patients, but my certainty is getting higher and higher, because I'm seeing cases like this where I didn't think I would get it this good, and now I can get it straight. I'm almost positive I can get it straight, okay? But this is your x-ray, okay? So now if we look at your MRI, and hopefully, I'm not sure how good you can see that on the camera, but he had a 7.83 millimeter disc herniation here. And then after doing his traction, he got all the way down to 5.75. That's amazing. So a 2 millimeter reduction. And this was only, you had your second MRI. When did you get that done?
Talking about this one?
Yeah, the second one. When was that?
That was a couple months ago too. So
a couple months ago.
It's probably smaller now even.
It could be smaller even now, because you're still doing traction. We're still adjusting you.
Yeah.
But this was about 6 months, and it's rare that we get to see a before and after MRI in a short period of time where we can actually compare it. But significant difference, and his reflexes are better, his sensations better, muscle strength
better. Life's great again.
Awesome.
There we go.
I know, it's awesome. So great patient, great circumstances, great results. You know, corrective care can totally work, and along with doing the home traction, my Fisher traction, helps a lot to build that momentum to get you up to the next level. Anyways, brother, I'm so happy.
Thank you
dude.
so much, Doc. It's
You
so
know,
amazing.
I know, me too. I'm
Totally right.
so
Yeah.
happy. You know,
Truly blessed.
and your
Truly.
dad's happy. Everybody's happy.
Everything's great.
You know,
I can show it to my family members too. Who
Exactly.
didn't believe,
exactly.
but now they will.
The MDs that didn't believe it, now we have proof. But anyways, if you suffer from scoliosis, disc herniations, anything like that, you have to try corrective care. You have to try it. And there's not a whole lot of chiropractors in the nation like me that do it, where I do before and after x-rays and include decompression also. There's about 10% of us. So you have to do some research, find out the best ones to go to. You know, we're Fisher Chiropractic of Irvine, California, where I grew up. This is my peeps, my family, you know, around here. But anyways, great case, great results. And if you need help, check us out.
Sweet.
All right, brother.
Awesome.